Today, we will be talking about systems of belonging, especially in light of the recent COVID-19 pandemic and the important impact it's had on healthcare organizations and teams. So over the last few years, the COVID-19 pandemic has led to a great burden on healthcare workers, especially among certain groups of people that are that are more marginalized. But individual healthcare workers are experiencing high levels of stress, and this has been having a great impact on patient care and on healthcare worker retention. People are working longer hours, working for their COVID-19 positive teammates, and experiencing challenges with patients that are in the hospital for a long time. Because of this, the question is, how can we make this better? Since the way that the COVID-19 pandemic is going, it's unclear when the impact on the healthcare system will change. So to address this, we have come up with a proposal here to talk about how we can work as interprofessional teams from multiple backgrounds to improve the systems of belonging among healthcare workers.
So first off, we just wanted to discuss as a group the concept of radical belonging and how that applies to us as healthcare workers. So the definition that we came up with as a team is a sense of feeling vital to a team and being encouraged to use your unique strengths to fulfill the team goal. And we also decided that employees should be encouraged to be inclusive with each other. We think that it's very important in healthcare right now, especially the way it is, to improve employee satisfaction and thus improve the productivity and patient satisfaction, because patient care is obviously the ultimate goal. And we think that this will create a sense of belonging that encourages employees to speak their minds and opinions in a respectful manner that leads to improvements in healthcare administration, teamwork, and patient care.
So before we go straight into our proposal, I want to discuss the proposal roadmap of exactly what we're going to talk about in this presentation. So first, we'll be talking about what are our recommendations to support radical belonging at the M Health Fairview. So this is more regarding discussing our concrete ideas of how we want to achieve radical belonging and the concrete ideas of how team leaders will be able to feel more safe and connected and willing to discuss their opinions and hope to improve healthcare. And after that, we will discuss how our interventions work considering the impact of COVID-19 on marginalized communities and the related stressors for healthcare team workers with marginalized identities. So we want our interventions that we discuss to be adaptable to multiple climates and situations, especially the situation we're going through right now with COVID-19. So we'll be discussing kind of exactly how that fits into the COVID-19 climate. And then after that, we will talk about the key implementation steps. So how exactly, what steps need to be taken to incorporate these interventions we came up with into healthcare systems and how that looks long-term and short-term, and make sure that it's something replicable that people are able to follow. And then after that, we will discuss the metrics of success. So how we are going to measure if these interventions are in fact making a difference. It's kind of like the SMART goals we've learned about of our of creating specific, measurable, achievable, and realistic and timely goals. So that's kind of what we'll be talking about of how to measure success of our interventions. And then after that, we will discuss how our idea is sustainable and scalable to other healthcare settings and organizations, because obviously we want these interventions to be replicable in many different healthcare systems, not just our local ones or specific to one hospital. We want this to be interventions that can be carried throughout many different systems.
So the proposal or our recommendations to support radical belonging are kind of twofold, and they mainly involve understanding what our team needs. So to do this, it's important for our team leaders to facilitate a discussion with the entire healthcare team from top to bottom to determine what makes individuals feel as though they do or do not belong or are appreciated for their work. So to do this, the first thing that we plan to do is to hold listening sessions for all levels of the healthcare team. So this is from the administrative down to the doctors and nurses and all ancillary staff and therapy teams to understand exactly what it is that is making them feel like they do or do not belong and what they are or not being appreciated for. Additionally, our team leaders should work with our members to create a safe environment to discuss inequities within the team in a productive fashion. In order to do this, we propose to initiate anonymous surveys for members of the team that are not comfortable with bringing up certain issues in a group setting. A group setting can be very scary for people that feel like they are not being treated equitably. So we feel that anonymous surveys allows for these issues to be brought up. And then kind of in a cyclical fashion, we can hold further listening sessions to discuss specific things that are brought up in these anonymous surveys so that the teams can fully understand exactly what is needed in order for us to reach radical belonging.
Some of our interventions as a group which might impact on the COVID-19 on marginalized communities and the related stressors for healthcare team members with marginalized identities are like providing bonuses, which might offer more incentives and bonuses to the medical staff so that the staff has motivation to work, and providing with enough resources to the marginalized communities as they in general lack the access to healthcare resources, and collaboration in between hospitals for even distribution of patients during the COVID-19 crisis, as all the hospital and the beds were filled up due to the enough patients, and recognition of medical staff every month for their contributions and excellence in providing services, and creating more PRN jobs for those people who could just pick jobs and work based on their flexibility and fill in those gaps as per the hospital needs, such as moonlighting and travel nurses, etc.
So we need to take a few steps in order to implement all of these changes, and they can't all be done at once. So we're just going to discuss a little bit about how we can implement certain changes at certain times in order to provide maximum satisfaction and efficiency within the hospital system. So the first thing that we kind of touched on a little bit in the previous slides is that we need to first, before we can implement anything, assess what the actual team needs are. And that's where the role of a team leader kind of comes in, such as like a charge nurse or an attending, or someone whose designated role it is to kind of evaluate a certain group of providers, is to ask the team what they need as individuals, what they need as providers working together as a team of, say, residents, or as a team of nurses to a certain hall, and then as partners with an overall healthcare group. So for example, as individuals, we can't work, we can say we might not want to work more than 80 hours a week. We need to cater to our own lifestyles as well. Working together in a group, this might mean such as like taking certain rotating holiday shifts between a group of nurses so that one nurse isn't working all of the same holidays. And then as partners with an overall healthcare group, making sure that for one patient that social work isn't getting left behind, that PT or OT aren't in the discussion, that kind of thing. And one thing to address here is that needs will differ between certain groups. So what PT, OT, nurses, doctors, pharmacists, what they all need is different as we go down each cohort. So we need to allow teams to voice their own goals independently and then cater to them accordingly. So What we might implement for the pharmacist is different than what we might implement for a group of residents. And then we take that individualized feedback according to cohort and create directed surveys, reward programs, and scheduling or patient changes. One thing to note is that it's important to start with small changes first and work gradually to improve and build upon those changes only if we see a benefit. We might think that implementing all of these changes at one time would be more beneficial, but drastic changes can actually increase stress within a working group, especially if all these different groups are dealing with changes all at the same time. And so that's why it's important to perhaps start with these surveys every week or every 2 weeks, as opposed to all of a sudden introducing like a whole new group of travel nurses or opening up a whole new shift of moonlighting shifts all at once. And so then in the long term, we can assess these changes every 3 months and release data from these surveys and build upon that, which will lead to the bigger changes over time. In addition, we could share ideas that do succeed between different groups. So what works for PTOT, they might be able to tell the team leader for the residents what has worked for them. And this will allow for increased growth throughout the organization as everyone shares the ideas of what works best for them.
In order to measure the success of the proposal we're presenting with you today, we feel that M Health Fairview should adopt the idea of basing your metrics around the goal of employee engagement. Employee engagement can be defined as the harnessing of organization members' selves to their work roles. In engagement, people employ and express themselves physically, cognitively, and emotionally during role performances. Simply put, this form of engagement is the strength of the mental and emotional connection that employees will feel towards their places of work. It's not, it's pretty well known that research shows that organizations with highly engaged employees tend to have a higher productivity rate, which tells us that more engaged employees work harder and they stay longer typically. And we feel this is an important point to hit home with you today, given the discussion of radical belonging we're presenting. You can't necessarily engage employees, though, if you don't understand what's going on with them in the first place. So being able to measure employee engagement helps you gain insight into what your employees think your organization does well and areas that you can improve on in the future. So what are some ways that we feel we can measure this? We have listed a couple options that can be easily implemented and are easy to use as a form of metrics for M Health Fairview. The first one being employee feedback. Having the opportunity to establish channels of feedback allows the organization to know what areas they can improve on from an employee perspective. Feedback can help the employees feel like they have a voice and that they are being listened to when a change or edit may need to be made. The second we've listed is employee recognition. It's difficult to feel engaged when your work regularly goes unnoticed. Oftentimes, lack of recognition isn't intentional by the workplace, it's just simply forgotten, especially during busy periods, for example, during peak moments of COVID. However, recognizing employees when work is extra busy or extra stressful is just a simple way that we can make people feel valued and improve engagement overall. Next, we have satisfaction surveys. An engaged team member will feel more satisfied with their role within their team and the aspects that surround it. So if team members don't feel supported with the correct resources or even fairly compensated for their work, employee satisfaction will thus decrease, and so will engagement. Lastly, we put wellness surveys. Organizations are now prioritizing health and wellness, and signs of stress and overwhelming workloads are important to flag within your own team and within yourself personally. Implementing wellness surveys helps provide an idea as to how the team has felt supported with any new changes that we have implemented or proposed to you today, as well as identifying how a person is doing individually when it comes to mental, emotional, and physical well-being. Utilizing these metrics of success that highlight in the domain of employee engagement can help M Health Fairview keep a safe and productive relationship with their team at the end of the day, while also helping to determine the success of the proposal we're sharing with you now.
So the next thing we're going to discuss a little bit is how these changes that we just discussed are applied to other healthcare settings besides a hospital such as SLU. So how sustainable and scalable these implementations can be. So changes such as well-being and satisfaction assessments are easy to implement in large and small healthcare organizations because they take up little time from the healthcare provider filling them out, and the progression is easy to follow. For example, one metric that SLU Med School has used actually is the WHO 5 Wellbeing Index. It's a series of questions in which people can scale well-being scores on a scale of 1 to 5, so that all of these numbers can be collected and then stratified in a way that's actually pretty easy when someone is assigned to this task, so that you can actually have solid number data to back up what your providers and employees are filling out. And so using models and questionnaires that are standardized between different groups allows for even somebody who's in charge of tackling, creating and collecting all of this data to not even have to devote that much time. For example, if you had like a small clinic running, this would still be doable. Implements such as bonuses and resources that we discussed previously can be harder to initiate. And so these are the kind of implementations that would be a slower, more gradual introduction. So the best way to do something like this, in our opinion, was to create task forces within departments or hospitals with goals of assessing the best ways to allocate money for resources catered to each organization, because needs may differ between hospitals. What your pediatrician clinic needs is way different from what St. Mary's as our maternal hospital needs. And so this may even involve assessing expenditures a hospital needs to cut back on in order to improve in other areas. So an example of this is that within our own SSM healthcare system, SLU is our trauma center. And as I previously stated, St. Mary's is our maternal center. And so St. Mary's doesn't need to spend an exorbitant amount of money on their trauma bay, whereas SLU does need to allocate a good amount of the resources to being a level 1 trauma center. Likewise, SLU basically allocates none of its money into being a maternal or NICU ward, whereas St. Mary's does definitely require the capacity for deliveries and labor and newborns. And so taking a look at even what your hospital is spending money on in order to allocate that to more efficiently running groups to increase satisfaction and cooperation between healthcare settings will increase employee satisfaction, the resources that employees have access to, and things like that.
So working within our group, we were presented with various cases and where we had different scenarios and where effective teamwork was not displayed amongst healthcare providers and patients and caregivers that were involved in the cases. Without effective teamwork, mistakes were made and unnecessary stress for both the providers and the patients involved was created. In these cases, we saw that both effective teamwork and communication was extremely important in order to achieve the goal in mind, which is the care of the patient. There has to be certain there has to be a clear direction of where we're going, the goal, the vision, the purpose. It has to be well defined so that everyone is on the same page and we know exactly what needs to be done to get whatever the patient needs. Also, there has to be open and honest communication. We have to be able to support one another. We also have to be willing to take risk and be open to change. The roles of everyone involved has to be well defined in order for it to work like an oiled machine and everything work together and cohesively. There should be mutual accountability. We should be able to call one another out if something is not working for a patient, because everyone has different expertises and you should not be afraid to step up and be confident in what it is that needs to be done to ultimately achieve whatever it is that we need to for the benefit of the patient. We also have to make sure that we keep that there's a common goal in mind, which is naturally the patient. And we have to take into account that everybody is coming from different background, cultural backgrounds, and it essentially becomes a melting pot of various opinions. We have to be able to closely collaborate with one another so that everything runs smoothly. And we have to, above all, trust one another, trust our teammates. So again, to reiterate, we should have effective teamwork, which includes collaborations amongst the providers and the patients, making sure that we keep the patients the center focus and having that same goal in mind when we're treating the patient. Everyone has their role, which is very vital into making decisions and the decision-making process for the patient. Effective communication is key in ensuring that teams function in a cohesive manner, bringing in various expertises, ideas, observations, and are critical in deciphering what is in the best interest of the patient. So working on our presentations, we were presented with various backgrounds, because we have OT, we have nurses, nursing students, we have med students and pharmacy students, and we're all working together on this project to complete for the IPTS. It's important to be on the same page in order to complete this task at hand, so that we can get the job done. It takes effort amongst everyone on the team to fulfill this vision and the vision that was initially agreed upon.
So to wrap everything up, when working with people from different backgrounds and schedules, discussion is absolutely necessary to determine the realistic goals and expectations that we can agree on for the best care of every patient. It is important to recognize that in the busy healthcare environment, everyone will work at different paces. We have to have that effective communication and understand what is going on in each role to maintain the best patient care. Like any other machine, the healthcare industry does not run efficiently unless all parts work. Opinions from all groups matter, and one cohort of voices, whether it's the nurse, the doctor, PT, OT, pharm, does not matter more than another. We would just like to thank everyone for the opportunity for us to go over this case, and thank you for listening.